Welcome to Progressive Short Takes. I'm your host, Joe Firestone. Is a second wave of COVID-19 beginning to build in the United States at present? Well, I think there's evidence, that it is. And to explore that evidence, what I would like to do is to go over some numbers with you concerning the reproduction rate. Actually, some graphs. So let me share the screen. These are the RT numbers. RT is the reproduction rate for the virus. The COVID-19 virus. It's R sub T. Of course, it's a key measure of how fast the virus is growing. It's the average number of people who become infected by an infectious person. If R sub T is above 1.0, the virus will spread quickly. When R sub T is below 1.0, the virus will stop spreading. So let us take a look. Okay, you see here the green are states where the rate of spread of the virus is declining. And there are many more states, of course, where the rate of increase, the virus is increasing. Roughly 30 of the states in the United States are increasing, and 20 of the states in the United States are declining. So that is not a good picture. But let us take a look at the situation with respect to regions. So you can see the graphs I'm showing. I'm going to be stopping at the eastern states. Okay, here's Connecticut. So you see Connecticut spiked at first, of course, then it dropped down. And at the beginning of April, it began to go into the green. So the increase in cases began to slow. Then the degree to which it began to slow decreased. And for a short time, let me get a little more room here so you can see this better. For a short time, the rate of increase was constant at 1.00. That was in June. From roughly June 24th to the beginning of July. Then the rate went under 1, in Connecticut again. That lasted until the end of the first week, in August. Then the rate of increase began to grow again. And the rate of increase, leveled off, but at 1.08, which means that the increase in COVID cases has been continuously increasing since roughly late, in August, up through the first half of September, up through September 13th. You see a similar pattern, okay, in DC. So you see that in 2 eastern states. Of course, the rate of increase in DC at 1.04 is less than it was in Connecticut. So the Mid-Atlantic, a little different from the New England area. But when you look, okay, at Delaware, you see that there's been a second wave starting there as of the 8th of August or so. And the RT there has gone up to 1.22, which is a very high value compared to other states. That is in the Mid-Atlantic as well. Things haven't been that high since very early in the game, April 2nd or so. There was a spike in June, but then it fell away, went into the green again, and then it began to build. And it went up to 1.2 on August 29th, and it has stayed in that range. And is now at 1.22 as of September 13th. As of September 14th. It's at 1.22. So that was Delaware, another Mid-Atlantic state. Next, as we move down, we're seeing other states. It takes us a while to get to more of the eastern states, but now we get to Maine. And you see, towards the end of August, that Maine went into the red again. And it's gone up to 1.05. I don't know if it'll stay there or go higher, but cases have been increasing in Maine now for some time, for that 2-week period. Okay, in Maryland, they went into the red on August 9th and hit a level of 1.11 on August 21st, and it has been more or less at that level until September 14th, when it was at 1.12. Similar situation in Massachusetts. This is the Mid-Atlantic. This is New England. August 15th, they went into the red, okay, in Massachusetts, and began to build. Now they're at the 1.15 level. They've been constant at that level for some time. That's a fairly high level, though. And as of September 14th, they were at 1.15 in Massachusetts. So you're seeing New England and the Mid-Atlantic states having increases of COVID at a fairly high level for some time now. Two to 3 weeks in some cases. And we get to New Hampshire, same pattern. Okay, New Hampshire, going to the red in early August, building higher and higher, 1.15 right now, as of September 14th. The reproduction rate. Here's New Jersey, not as bad as in New England. But it crosses into the red sometime in early August. It's been moving up slowly since then. It's now at 1.06. New York, same thing. August 6th, building a second wave in New York slowly. 1.08, 1.07 as of the 14th. Second wave hasn't reached down into North Carolina yet. You can see that's 0.89. Hasn't quite reached Ohio yet, though Ohio is at 1.00. You can see Rhode Island not as heavily into it, but the second pattern there also, as of August 25th, it went to 1.01. Now it's at 1.02 as of the 14th, just slightly negative. Vermont, pattern typical of New England, went into the red about the middle of August. It's been there since, now as high as 1.15. So that second wave is building in New England. Here's Virginia, which you can probably now classify as a mid-Atlantic state. And Virginia had a spike during June, July, when it allowed restaurants to open, went up to 1.09, started going down again, went into the green again, went into the red around August 8th, but just slightly in the red, got as high as 1.05, went down to 1.03. Virginia, Mid-Atlantic states. West Virginia, ooh, another Mid-Atlantic state. They spiked early in August back into the red, went up to 1.26, as high as an earlier spike in June. Went down slightly, but has been 1.25, 1.24, 1.23, 1.22, 1.21, 1.22. Since that time, cases increasing at a steady rate each day, but at a high level. Wisconsin, a Midwestern state that it's a high level, okay, of reproduction rate, okay, at this point. But basically, what you see here by looking at these graphs is that COVID-19 is once again continuing in the mid-Atlantic states. I missed Pennsylvania before. It was up to 1.09. It had been up higher, 1.11 as of August 21st, but has remained at that level of slow increase in cases. 1.09 still remains there now. So there's a second wave building in New England and the mid-Atlantic states. The weather is now just starting to turn, okay, a little colder. It's starting to get to ideal virus weather. We have to expect that those cases might spike higher. On the good news side, there is some good news. The fatality rates seem to be going down as the hospitals and the doctors get more experienced in treating the virus. If we look over, okay, at Europe, we can see some places like Spain are getting a second wave after they had been really way down for some time. But as I said, the good news is that we seem to be able to treat it better and lower the mortality rate at this point. It remains important to restrict the spread of the virus as much as we can now, so that experience with treating it, even without a vaccine, improves. It's better, as it has been since the beginning of the outbreaks, to postpone the spread of the virus as much as we can to allow our medical knowledge to catch up with it, both in terms of vaccines, but also in terms of being able to help people to get over the virus, okay, if they do get it. So important to slow down those cases. Danger is coming again. We have definite signs of a second wave here now when we look at the RT statistics. So I wanted to cover that. I wanted to tell you about that. And I hope you like that short take. I personally think it's a very valuable one, even though it is a little disturbing. Have a good day. I'll be back with another short take soon.